Well, joining me in studio now to give us a status update on the vaccination exercise is Dr. Willis Akhwale, the chairman of the COVID-19 Vaccine Advisory Task Force. Secretary, thank you so much for coming in. A lot of questions, especially when it comes to the supply of the doses. Earlier, we've just reported that there is an indication, at least from the Ministry of Health, that we may run out. What can you tell us about that?
Thank you, Victoria, for hosting me. Thank you for giving me this opportunity to clarify some of these things and give Kenyans an update on the status of our vaccination program, which is proceeding very well. Right now, we are almost 500,000 Kenyans have been vaccinated so far and reported. And one thing I want to clarify, there's no slowing down. In fact, we are accelerating. We are accelerating the vaccination. During the first week, we were vaccinating 3,000 Kenyans a day. We moved then to 12,000. We've been at 20,000, and I can assure you in the past 1 week, we've been vaccinating 30 to 40,000 Kenyans a day. We've even hit a record 43,000 vaccination a day. And this is when only 180 facilities out of the 600 we want to use. So we can ramp up the vaccination actually to even 100,000 per day. But in our estimate now, we have about 100,000 doses in the central stores, and we have another almost 245,000 at the regional stores. So we have about 500,000 doses that we have to utilize. And at the rate of 40,000 a day, then we are looking at about 10 days and we will not have vaccination. The enthusiasm, the uptake has really increased, especially among Kenyans, the elderly ones who are at most risk of severe disease. So it is not the slowing down. We are not going to slow down, and I want to urge Kenyans. There's been assurance from none other than His Excellency the President on the second dose. We at the Ministry of Health, we've been holding discussions with the Gov't and the COVAX mechanism. Right. And they have assured us our supplies are coming in May. And what we just don't know is whether it is early May, mid-May, or late May. But whatever the case, remember the second dose of AstraZeneca can be given between a range of 8 to 12 weeks. The task force had recommended 8 weeks. We can also extend this to 12 weeks, and we can make that announcement once that decision is made. It's a discussion. We will be engaging COVAX this week so that we have an indication as to when these vaccines come.
So should COVAX delay for whatever reason, what are the other approaches or other options that the government is looking at? Because right now we're just about to outstrip the supply, at least for the first stock that came in. It was over 1 million doses that came in early March, right?
Yes.
So if we're going to the 500,000 mark, we run the risk of people who've just gotten their first dose not getting the second if COVAX delays.
That is what I want to assure Kenyans. The second supply is coming. And now, in addition to that, we have also been instructed by none other than His Excellency the President, Uhuru Kenyatta, that he wants all eligible Kenyans vaccinated quickly. So, in fact, in the last 1 week, what the Ministry of Health has been doing has been engaging not only COVAX, we've been in discussion with the African CDC mechanism, and we've also been in discussion with all manufacturers that are producing the WHO-approved vaccines. And I can tell you, yes, we are there. It's a matter of time. I can assure Kenyans, from next month, there'll be vaccines for every Kenyan. So just be patient.
You're directly speaking to manufacturers. Which manufacturers?
Let me not say at this time until the deal is done. We will let Kenyans know who are these manufacturers and what arrangements we have with them. It will not take long. We are really in almost the tail end. We have support from across government departments and ministries, and this should be concluded in a very short time.
You mentioned uptake is quite encouraging, but when you look at the numbers, at least from what was released by MOH yesterday, over 400,000 people have been vaccinated so far. But when you look at those numbers, I know CS Kagwe had said during the arrival of first consignment that you want to vaccinate at least 400,000 health workers. So far, only 110,000 have gotten the vaccination. Why is there such a slow uptake among that very critical group?
Yeah, so one of the things we need to know is that this was a new vaccine. There was an introduction of the vaccine. The other thing you need to know that a lot of the majority of health workers work in facilities at the lower levels. Now, if you look at our plan, we started with one hospital at the county level. Then we are now going to the sub-county level. Many of the health workers are waiting for the time that their facility is going to get that vaccination, and a lot of that is going to happen from this week. So that is one. Not to really say there's been no hesitancy, that may be there, but we've been engaging the medical associations. We are really also looking at the message, and we've been discussing with the Council of Governors so that many of the health workers are also on the forefront to start getting this vaccination.
When we talk about the supply, how much of a factor is India? We've seen the Serum Institute slow down because they want to at least respond to the local demand. So what does that mean for us in terms of imports?
So, as the WHO Director General, Tedros, has clearly indicated, this is a global, it's not just the COVAX mechanism. I think the whole issue of inequity is arising from the fact that some of the developed countries are actually committing, or they are placing orders for manufacturing. We know countries with populations of 38 million, but putting commitments of 300 million doses.
So they're overbooking. They are
overbooking. So it's making it difficult for other people to get into the queue. And that's why it is taking long. And to complicate, actually what the problem is not COVAX the mechanism. As Tedros has said, it's not, the vaccines are not inside the COVAX. It's the manufacturers. And a manufacturer, there are many aspects about manufacturing. The overbooking is one. And another one is also the goods that are used to manufacture the vaccines. Some of the manufacturers, some countries are also holding back on those goods that are used to manufacture the vaccines. So it's making it also difficult for some of the manufacturers to meet their demand. But what I've said, the Minister of Health has been in discussion. We now understand the landscape. We've been able to map up, and we now have a very clear path of ensuring that Kenyans will get the vaccine. Kenyans will be vaccinated, and you'll see a ramp up of our vaccination program in a campaign mode not many weeks from now.
You mentioned earlier that the government is looking at talking to manufacturers directly. How different is that arrangement from, say, Sputnik and the private, consignment that we saw come in?
Let me first say the arrangement is bilateral, government to manufacturer.
Okay.
And there are terms, there are different terms, and that's what we've been engaging to understand them, to see how it fits within what our regulations say. But very good progress, almost there, and we'll let Kenyans know. The private sector involvement, let me just say, what happened was a ban, but until further notice, but with instructions that we must come up with a framework that is transparent, that will ensure public health safety, that will ensure that Kenyans are not exploited. We've already started having discussions with the private sector to come up with that framework. Until that comfort is there, that ban stands.
Is there going to be specific funding, for instance, if you're engaging the manufacturers directly, that will be needed?
That is the work of the National Treasury, and they are looking at it.
How much are you looking at if it has to go that route?
For us, we want to vaccinate as many. In fact, right now, we are looking at the entire adult population in the shortest time possible. Once we get the commitments and we know how many vaccines will come per month, we are going to announce and give you our revised and updated deployment plan.
Are there any interest from local players, commercial interest, for instance, in procuring vaccines, and how is that being monitored?
At the moment, we are looking at the framework. We are going to give our guidelines. The regulatory body, the Pharmacy and Poisons Board, and the Kenya Medical Practitioner and Dentist Council are the ones discussing. They are leading the discussions, and they will lay that out. However, also as a country, we are looking at partnering and ensuring that in the next not so distant future, we are also part of the manufacturing processes.
All right. Let's see if all that comes to pass. Dr. Akhwale, thank you for your time and your insights and giving us perspective on what is happening with the vaccine.